Don't ever let anybody steal your joy.
She's the baddest boo with the natural do. She's taking the talents to the new YouTube. If you like her style, please don't bite. Give it a thumbs up, comment, and please subscribe.
Hey guys, it's Rhea Michelle, and welcome to another beautiful day that God has blessed us with. I just wanted to give you a little bit of an introduction to this vlog for the part 2 of my new nurse and preceptorship experience. I didn't mention it in the previous vlog, but I was very blessed to have gotten the preceptor that I got. She is actually one of the best on my unit, and she has lots of experience, is very patient, very kind. She just knows how to teach very well, so that you'll grasp the information and you'll be able to progress on your actual track. In this vlog, I wanted to mention just a few more tips and a few things that I didn't mention in the vlog that you'll see. That body mechanics is very huge. That's something that you guys must have. Let me just talk to you a little bit about body mechanics. So with that means when you're going into a patient's room, make sure you actually raise the bed to waist level. There are so many times that I got caught bending over to try to get to the patient and examine maybe their IV site or flush their line or do my assessments. That's not something that you want to do, because over time the muscles in your back are going to start spasming and getting tired, and you're going to mess yourself up. That's not what you want to do. And I got that tip from a PCA. So let me tell you, listen to your PCAs when they have a suggestion for something. They know all about body mechanics. That's a very large part of their job, as well as ours. So just make sure you practice proper body mechanics. Also, the number one thing is praying before you go into work. Pray about the whole experience, actually. Pray about what you should do as far as your job is, if you should specialize, if you should go into a hospital setting, if you should go into a nursing home setting, whatever it may be. Prayer is something that should be at the top of your list for everything. I prayed before I even got this job about getting it. I wanted God to choose this perfect position for me. I also prayed about the whole preceptor experience, and on a day-to-day basis, just praying that the day that I have is going to be a great day, because it really does change how your mindset is, your perspective of things. Instead of sitting there and feeding into all the negative, like, oh, like I gotta be here for 12 hours, or oh, I may have like a patient that requires a lot of assistance, or whatever it may be. Don't think of it that way. Think of it as you are given an opportunity as an able-bodied human being to help somebody in need. And something my mom always tells me is that you are blessed to be on the giving end of care rather than the receiving end. Because who wants to be in the hospital in the first place? Nobody wants to be sitting in there sick, not able to do things for themselves, their privacy violated. They have somebody coming into the room all hours of the day and night. Nobody wants to be in that position. Nobody really wants to have to call you for everything. If you have them on fall precautions, nobody wants to sit there and say, I really have to go to the bathroom. I don't want to go on myself in the bed. I want to be able to just get up. I want to go and walk to the bathroom on my own like I do at home. So be grateful for that you're able to help people do those things, and just pray that you keep that mindset. One thing that one of my patients told me is that they appreciate the smile that I have, even though they can't really see my face because of the mask, but they can tell that I'm smiling behind my mask, and they can just tell based off my personality that I'm not the type of person who feels like they are a bother or that they're a burden because they call me for different things or they need help with different things. And because of the persona that I give off and the vibe that I give off, they consider me to be a joyful person. And I speak in this way humbly. And one thing that is going to stick with me, and I want it to stick with me throughout the rest of my career, honestly, even the rest of my life, it doesn't even have to apply just to my career, is she told me is don't ever let anybody steal your joy. And I'm always going to remember that, because it's true. Why go in and allow somebody, maybe a negative Nancy or even somebody who's just having a bad day, come in and make me also feel the same way. I don't have to possess those negative mindsets. So why do I need to feed into that? You know, like I want to keep that joy, and I want to keep that joy with all my patients. No matter what their background is, no matter the types of things they say to me, I always want to think to myself, do not take this personally because they are just meeting you. And they really just want to, either if it's the family, they just want the best care for their loved one. If it's the patient, they want the best care for themselves. And it's a frustrating position. A caregiver may be burnt out. The family member may just be sick and tired of being in hospital. It's probably the worst day of their life. I don't want to sit there and make it even worse for them by allowing myself to be negative about a situation. So that's really something that I wanted to mention before we get into this vlog. But thank you for watching, and enjoy the rest of the tips that I have and my experience that I'm going to be sharing with you. I am on the last day of my second week, so that's my 6th day in, and my patient load has increased to 3. So just some advice for you. What I wanted to really mention was, when you are beginning your shifts, I highly recommend praying. And this is just because it gets your day set off in the right way. Your mindset changes, and you are given more confidence through God. Because when you go in there, you're going to feel like, okay, this is so much stuff. I have to worry about medications. I have to make sure all the patients get everything they need, all the tests that are ordered, all the things that the doctors are asking, maybe things that the family may be asking, you know, if your hospital is allowing patient visitors. So this will kind of keep your mind a little bit calm as you're going into work. Another thing is, it will allow you to sit back and realize, okay, like, this is the purpose that God set out for me in my life, and He's going to put me with everything that I need to go forth and do what I have to do and do the best job that I can do. So then you don't have to worry as much about, okay, am I doing this right or that? Because you know that you're going to be able to go to somebody who is going to help you out. Or you know that you have that knowledge from nursing school or whatever other experience you may have to do what you need to do. My personal thing is, I like to pray for my patients as well as my colleagues and other people who are employed at the hospital, just because, like, this is a tough job. It is something that is highly valuable. Every single position, from the people who are in the environmental services team cleaning up, especially during now, to the doctors, and of course the nurses and the PCAs or CNAs, whatever they're called at your hospital, to the secretaries. Like, everybody is playing a pivotal role in making the hospital function as it should, and making sure that patients have a good experience as well as being cared for, so that we can save as many lives as possible. So prayer is like a big part of my career and my day. Another thing I wanted to mention was familiarizing yourself with some of the common meds before. Now, this may not be something you can do before you start on the floor, simply because you may not know the medications that are normally ordered for those patients. So on my floor, like, I've learned to see that, you know, on the oncology unit, of course, there's a lot of chemo that's ordered. But because I'm not an oncology nurse, although I'm following one, I won't necessarily be familiar with a lot of those medications, and I'm not allowed to give them anyway. So that's one thing. Like, if you were going into oncology as a specialty, you'll be able to see some of the medications that are commonly used for different types of cancer, and then that way, whenever you are able on your spare time during the week, I'll just recommend, you know, just take like an hour or two to sit down, go through the different medications that you've seen, write them down as you give them, and either look it up while you're at work, because a lot of systems have a drug guide to look up all the medications, their actions, the effects, side effects, things like that. So I recommend looking that up just so you're able to be knowledgeable whenever a patient says, hey, I'm getting this medication, but I don't normally take it at home. What is it for? And you can easily be able to tell them, this is the generic version of blah, blah, blah. These are the side effects. This is what, you know, you'll expect whenever you get this medication. This is why the doctor ordered it. that's what I plan on doing with, a lot of the high blood pressure medications. I was able to experience having patients that were more in my specialty, well, not necessarily specialty, it's more of like a generic, like medical, surgical. So that was something that was more eye-opening because I came to realize, like, okay, like, I was actually helping with the oncology patients and the patients who had innumerable medical illnesses and conditions that required lots of tests throughout the day. They required lots of medication. So I would medicate these other patients that were unfortunately very ill, like sometimes every 2 hours throughout the day. And then on top of that, doctors would order tests on them so they could rule out other problems that they may have. So I would have to, help with that process, whether it was collecting samples or making sure that the lab got to them. And then they would have family presence, which would have, they have more questions. So then I would have to be there for that. And then because they were so ill, they required a lot of attention. So I would have to make sure their vitals were taken care of. I would have to go into the room and make sure that, if they had to use the restroom, I would be there so that I could analyze and assess what type of output they had. So it was a lot, and I did that on purpose, like I mentioned before, because I wanted to see what it was like to deal with someone who was very ill and manage my time on top of that. But I do see why, like, my preceptor was like, okay, like, I need to put you on patients that you're actually going to have, and that made my day go by a lot more differently. Like, I felt like my time management was way better. Like, I wasn't waiting to chart at the end of the day, everything. I was done charting by the time I was actually supposed to be charting. I was even able to discharge one of the patients, which was really good. So that's something that if you have one of those units where it's like multiple things, I do recommend getting your experience in all areas. But if your preceptor isn't already gearing you towards patients that you normally would work with, I would recommend suggesting that you do so. So I just wanted to leave you with some final tips that I wanted to mention. Whenever you are beginning your career in nursing and you are going to be starting on the floor, especially working those 12-hour shifts, many of us are not used to 12-hour shifts, so just be prepared for it to be very tiring. And it's okay if you're tired. This is completely normal. It's part of your body adjusting to it. One thing that an instructor told me that was very helpful is you will only have to give your all for 12 days out of the entire month. So just keep that in mind and know that you're only going to be working 3 days a week unless you decide to pick up extra shifts. But I would not recommend doing that until you are completely comfortable with your role, because doing 4 to 8 hours in 4 days is a lot rougher than you think. So just make sure you're comfortable with the 12 hours, 3 days a week first. The other thing I wanted to mention was making sure you have comfortable shoes. I cannot stress this enough. You have to be able to stand on your feet for as long as you need to. On one of the days that I began, I was literally on my feet the entire day because we're super busy, and the only time I got to sit down was during lunch, and that was only 30 minutes. So be prepared to be able to stand for 12 hours. For the shoes, it really depends on your preference, but my recommendation is to just try on different types and see what works best for you. I personally like to wear Adidas Boost, but I didn't want to wear it in the clinical setting because they're made out of canvas material, and I didn't want any like fluids or anything getting on them and leaking through to my sock and of course my foot. So just try out different types of shoes. I know there's things circulating out there like the Dansko shoes as well as the Hoka running shoes. I'm personally wearing the Dansko shoes. I'm not representing them in any way. Right now I'm still breaking them in, and I've worn them for, let me see, I think today is going to make 7 shifts. So they have gotten progressively more comfortable. But I do have to say that, like, when you start wearing them, they are hard because they're meant to form to the arch of your foot so that you will have good support. One thing I've noticed between, like, some of the cheap shoes that I bought during nursing school and these is the fact that they help support my back better. So I don't have lower back pain like I did during nursing school working in the clinical setting. Also, make sure you invest in some compression socks. You can get them pretty much anywhere. Amazon has them, which is where I got mine. They basically look like this. So I just wanted to show you here. So you'll be able to get that circulation going in your feet, and they won't be swelling at the end of the day. Like I'm telling you, it will make a huge difference. Please invest in some compression socks, and it'll help with varicose veins in the future as well. Invest in some comfortable scrubs, and I personally like to have lots of compartments in my scrubs. I even have zippered compartments in these scrubs, so that is helpful if I need to carry certain things. Like I keep like the key to my locker in there, so I know I won't lose it by pulling out maybe like alcohol swabs or something that I use during there, my pen light. And yeah, like honestly, let me see, I'm thinking about different materials you may need. I would get a pair of scissors if you don't already have them from nursing school. You can also get a pen light for your assessments. Of course, a stethoscope. Please don't go without your stethoscope. Get a notepad of some sort so you can use to write down the report. And I have this headband just in case I have any masks at the hospital that they provide. If they fit too tight behind my ear and it's irritating. Oops. Sorry. So if it's time for me to leave, but if it fits by my ear and it's too irritating, I have these buttons. This is very helpful to just hook it onto instead. There are other things that you can buy to cover your entire head if you'd like. That is pretty much what I have as far as being at the job. But whenever you do come home, I recommend that you give yourself some time to just breathe a little bit, relax, regroup, because you use your mind all day long. You're constantly critically thinking, whether you have really high acuity patients or if they're not as high acuity. And you need to be able to relax because you're physically, like, you're on your feet all day, you're walking around all day, you're doing this, that, and the other. And then you're also constantly thinking, okay, you know, I need to make sure my patients are taken care of. So whenever you get home, and because sometimes you may not get a chance to eat as much as you normally do, make sure that you have a nice, nutritious dinner and that you get a chance to just unwind and relax, especially if you're doing back-to-back days, because that is going to give you energy you need to carry out the next day. And I have not yet worked 3 days in a row, but I have been told that it's not as bad as a lot of people may think. Yes, like when you're thinking about it, okay, like you're just doing 36 hours straight, like that is a lot. But if you're already on a roll, it helps you just stay productive and stay on that roll. So by the third day, you're not being sluggish, you're not dragging or anything, because when you take that break, it's like your body almost like does a little bit of a hard reset and says, okay, like I've gotten a chance to do my own schedule today. So now to the next day, I'm gonna have to dedicate 12 full hours or 13 full hours, however your floor does it. And that may, you know, change your mind a little bit of how you manage your time. So that's just something that if you're thinking about doing 3 days in a row, I recommend that you try it. Just make sure you're getting plenty of rest. Don't try to do this on a little bit of sleep, because remember, you're using your mind all day. You need to be present all day for your patients. So that's all I have for you all. I hope that everybody has a wonderful week. And thank you again for watching, and take care.